Mental health problems is as much a pandemic at this point as is COVID. The coronavirus infection may be short-lived, but the impact on people's mental health will remain for months, even years, and beyond COVID if we do not respond and address mental health issues right now. Promoting the prevention of mental health problems during this time and addressing the impact on mental health of nations must receive equal and adequate attention, both within the response of COVID and within the public domain messaging. Mental health services and support must be readily available to anyone who need it, and must consider the context in which people find themselves, both socially, culturally, religiously, whether they in care homes, hospitals, living alone, living with family. We need to consider the specific and unique set of needs of each individual. A blanket approach or one-size-fits-all will not work. It is critical that we listen to the voices of people with lived experience so that they can identify and guide governments as to what initiatives or innovations would be suitable to help them alleviate the stress and anxiety in the current situation. People with lived experience with existing mental health conditions are going through a particularly difficult time, experiencing all forms of emotions and struggles in dealing or managing their symptoms of their mental health condition. And it's important that governments are aware of the restrictive measures they put in place in response to COVID, such as lockdown measures. This has a tendency of isolating people even more than they used to, or creates more anxiety and put people at risk of relapse. Many people with lived experience fear that they will not be able to access their usual treatment or recovery pathways. Following the formal announcement of COVID-19 being declared a global pandemic, governments took it upon themselves to develop a response. Unfortunately, what we see is that mental health has been severely neglected within these response measures. So the measures imposed on particularly people with mental health conditions are having negative consequences because their needs and challenges has not been considered within these responses and more likely to aggravate their existing conditions. Furthermore, we always talk about active involvement and transparency. And in my view, governments should have consulted people with mental health conditions to ensure that there is an adequate and responsive plan in place to support them and provide them with services during this difficult time to minimize further and aggravated symptoms. I was diagnosed with schizophrenia more than 20 years ago, and over the past 10 to 15 years, I've been able to manage my condition quite effectively and achieved quite a lot of success in my life. But during this time of COVID, I find that I experience extreme difficulty in actually managing my condition. For me, I'm not that concerned about contracting COVID or coronavirus as such. What concerns me most is actually the impact on my mental health. For example, I've noticed that I experience quite a lot of difficulties in terms of determining what is real and what is not. I also find that my concentration, especially in my memory, is severely affected. I have days where I am unable to function properly. Even performing very simple tasks like making coffee, for example, requires a lot of concentration to make sure that I'm doing it right. I also do find that I present with all the physical symptoms related or associated with stress. For me, being in a leadership position, running my own organization, also causes quite a bit of difficulties in terms of me. I need to be strong so I can support those within my organization and also those around me experiencing difficulties with their mental health. I do hope that mental health receives adequate attention, both in terms of resources allocated to it, to really help people with mental health conditions deal and cope with the current situation, but also going forward.